And so the reality is that when someone is sick, we all come around people and we support them. We should not be treating the victim. The enemy is the virus. It's almost like saying that someone who has malaria, you want to tell the person that they are the problem, but the problem is the mosquito. So it was to make sure that people understood that having COVID-19 is not a problem. You are the victim. But knowing and having knowledge, you can make decisions. As compared to not knowing at all and trying to hide, you rather will spread it to people. So actually, that was why we came out.
Dr. Elikem Tamakloe, did you consider the implication of your actions, knowing very well that your late dad, Dr. Tamakloe, may so rest in peace, a military man, he built this hospital, Nyaho Medical Center, with his sweat and toil. You were not going to use the family legacy, were you?
Not at all. If I was sick, the board needed to know what was the plan because anything could happen to me. And that's why I had a team around me who kept the organization going whilst I was unwell. It was also useful because the board was able to look at, okay, what would happen if our clients or if our corporate clients, our patients, if people are saying different things, if I'm not transparent, are we living up to our values? And that was important because at the end of the day, we have to be transparent as healthcare professionals. We need to be transparent with where we are at to build trust. So the spirit of what I was doing, which was about making sure that I was being authentic and I was being transparent, was important so that I could help people get the right context.
I hear people say that the health minister missed a very important or critical chance to reduce stigma when he told one journalist that he was only resting at the UGNC center, when in actual fact he was being treated for coronavirus related illnesses. Couldn't have done any better.
So I actually, there's so many cases that it's always difficult to know exactly which case you're referring to. But at the end of the day, one thing I've always believed is that life is sacred, and that most doctors and nurses all come to work because they want to preserve life. No one intentionally is there to disrupt life. But also doctors and nurses are human beings. And just like you, it's like the pot calling the kettle black or pointing a log at someone. I mean, if you take a harsh view of life, the reality is that all of us have made mistakes. All of us, have done things which we don't want to do. That is why we need to be transparent. It is why we need to create a culture where we can actually call out if something is wrong and it needs to be improved, then let us call it out and let us improve it. And I think that is really what I hope people will take from all that. There's so many lessons that we need to learn. And even right now, I think that every country around the world, you hear about this in the UK, you hear about this in the USA, in China, even the WHO has been criticized. It is not about the criticism. It's about, okay, what is the lessons that we need to learn?